35 years ago, maybe even longer, I'm taking one of my first CE courses. And back then, it was total disruption from a guy named Dr. Harold Gelb. Okay, this is crazy. But at some point, just weeks ago, I meet his son, Michael Gelb. I mean, chills for both of us, but why the chills? I'm telling you, this is part of disruption. We have to think differently. And as a profession, we're going to think differently. And we're going to be talking how TMJ, airway, and ortho really have to be our thought process first, and then moving to the remainder of dentistry. Michael, guide us further.
TMJ is the entry point. And so patients come in, they don't come in saying, Lou, I've got an airway problem.
Right.
They come in going, I'm clenching. I'm breaking restorations. I've got a headache. My jaw's sore. I got a pain here. I think it's the tooth. We've got to start with TMJ as the entry point, as part of TMJ, airway, and ortho, because people are in our chairs right now complaining, wearing down teeth. So TMJ is the entry point. It's something every dentist should be looking at because 50% of patients with TMJ actually have an airway problem.
Okay, so TMJ, those are 3 letters that scare most dentists unbelievably, and you know it. So how do we take a dentist into this new realm and out of their normal, into a new comfort range of where they got to go? Talk to me.
Dentistry has been a retractive profession for 100 years. Centric relation, it was always confusing. Centric relation, maximum. So we used to shove the jaw back.
Right.
Most dentists don't want to bring the jaw down and forward because it's scary.
Right.
Where am I going with this? We are simplifying the process, and we use a bite plate, a day plate, some people call it a Gelb appliance, and we use a new night guard, which we can talk about, as kind of the entry point. It's something that every dentist makes night guards. We're going to teach the dentist how to solve the problem during the day. Earaches, tinnitus, fullness of the ears, jaw pain, headache, and neck pain. And we're going to show you how the dentist is probably the best healthcare professional to do that.
Okay, Lane Martin, dentist in New York, you've changed your whole life about what me and Michael are just talking about. Walk me through a 1-minute cliff note of your life and why you changed.
Had a great career as a restorative dentist in New York. Fixed broken tooth after broken tooth.
Smile after smile.
Smile after smile, fixing narrow buccal corridors, increasing vertical dimension. I was treating symptoms, right? I was never treating the problem. And a gentleman that I taught with at Coyce really opened my eyes to airway and sleep.
Right.
And the more I dug deeper, I realized that we were fixing symptoms of a bigger problem. I realized that orthodontics was really a great way to fix the problem. Sold my restorative dental practice at the age of 45, about to finish up my orthodontic and craniofacial orthopedic residency, and along with Michael and along with you, help change the world and really help dentists make the paradigm shift to look at airway first and not teeth, because that was my world and it was the wrong world for a long time.
So now my question, you're going into ortho. This is a profession that doesn't think airway first. Talk to me as a general dentist, as a future orthodontist. Where are we going with this?
I mean, when I met Michael, and even when I met you, it was, let's disrupt the industry.
Okay.
And the fact is, for so long, and Michael alluded to it, we've been retracting patients, right? Everyone does Invisalign, they do IPR. They're still retracting people. We need to do better, right? We need to do better, and especially not just the restorative community, the orthodontic community. And we really have an amazing opportunity to change lives.
Now, there are orthodontists who do follow this 100%.
For sure.
Yeah.
I trained with several of them. Even my program director now believes in it. But that's not the norm, and it has to become the norm.
Right. And just lastly, even with a company like Invisalign, they can follow that pathway and not be pulling back, but expanding, correct?
For sure. And listen, Michael and I talk to orthodontists and general dentists all the time that do ortho. They do clear aligner therapy. Something as simple as uprighting molars.
Right.
You give someone better tongue space. They're going to be breathing and sleeping better.
August 27th, disruption time. Mike Gelb. What do you think? What do you think, Elaine Martin?
I'm excited.
I think it's really time to change the course of how we're really diagnosing and treating our patients. Final words, Mike?
TMJ Airway Orthodontics, the TAO, the path, the journey. Come with us.
See you then, August 27th.